Good morning. Thank you for joining us for our April presentation in the fourth year of our speaker series, Toxicology and Societies, the Impacts of Chemicals in Our Lives. I'm Ian Moran, a visiting assistant professor of environmental toxicology and chemistry at Western Washington University. I am joined by my co-hosts, Ruth Sofield, an environmental toxicology and chemistry professor, and Tracy Collier, a toxicologist who's retired from NOAA's Northwest Fisheries Science Center and continues his work as a consultant. Welcome both. We would like to begin by acknowledging that we at Western Washington University are on the ancestral homelands of the Coast Salish peoples who have lived in the Salish Sea Basin, throughout the San Juan Islands and the North Cascades watershed from time immemorial. Please join us in expressing our deepest respect and gratitude for our Indigenous neighbors, the Lummi Nation and Nooksack tribe, for their enduring care and protection of our shared lands and waterways. And now I'd like to go over a few logistics. We will save your questions for the end of the presentation, but you can use the Q&A feature on your screen at any time. You will be muted throughout the presentation, so we will use this feature to interact. The focus of our speaker series is to provide understandable examples of how events with a toxicological component have consequences to people and societies. And today we are delighted to welcome Pamela Miller, founder and executive director of Alaska Community Action on Toxics. And today she will share some highlights from her decades of work advancing community-based research in Arctic communities disproportionately impacted by hazardous chemicals. Welcome, Pamela.
I'm so sorry. My computer is very slow. So thank you so much for the introduction. And I'm really honored and pleased to be with you virtually here today. And so I will go ahead and start my slides. And I really welcome questions and discussion at the end. And again, thank you so much. Really just pleased to be with you today. I'm going to go ahead and share my screen. And I do apologize. We're having some technical difficulties here with, I don't know if this has to do with the sunspots we're having in Alaska, but it seems to be interfering with things. Okay.
Looks like I'm seeing that you're sharing screen now. I'm sure it'll pop up in just a moment here.
Okay, very good.
All right, I think if you enter presenter mode, you should be all set to go.
Right. Should be coming along here shortly. So just to say, while that's uploading, just to say a little bit about myself and our work here. My training is as a biologist, and I certainly have a special fondness for the coast of Washington State in particular. I used to work as ocean issues technical coordinator at the Washington Department of Ecology, and we helped to establish the Outer Coast National Marine Sanctuary. So again, just really glad to be with you today. So I serve as director of Alaska Community Action on Toxics and also the co-chair of the International Pollutants Elimination Network, which is a global collective of organizations working for a toxics-free future. So more than 600 organizations in 120 countries work to achieve chemicals policy changes on a local to international level. So this just describes a little bit about my organization, Alaska Community Action on Toxics. We're statewide, nationally, and internationally to protect the health of people, wildlife, and certainly future generations. And we do this through community-based participatory research. We do a lot of training and educational programs, community organizing and advocacy to achieve those policy changes. And then we work at the local level on things such as trying to affect cleanup decisions about hazardous waste sites, state policy on chemicals, environmental health, and justice, and then at the national level on laws such as the Toxic Substances Control Act, Clean Water Act, Clean Air Act, and so on. And at the national level, I'll talk more about this later, but we work, because of our position here in the North and the Arctic, we can't just work locally, we have to work internationally because chemicals don't respect political boundaries. And I should say that I am calling in today from the traditional lands of the Dena'ina people. And this talk will be primarily about the work that we've done on Sivuqaq, which is the traditional name for St. Lawrence Island. And this is a woman that we always acknowledge in our talks. Her name is Annie Aloha, and she was a very respected elder and community health aide who began to witness the health disparities that she attributed to the military contamination on Sivuqaq. She witnessed higher rates of cancer, as well as some of these other health disparities that are listed here, including reproductive health problems, miscarriages, and birth defects, and endocrine disorders. And she continues to inspire our work every day. She passed away in 1999, but she was really the reason that we got this community-based research project going. And soon after she passed, we were able to get our first National Institute of Environmental Health Sciences grant, environmental justice grant, to begin doing this community-based research. This is a map that we created several years ago because we found that the state and federal agencies may maintain their own databases of contaminated sites, but no one was really synthesizing this in one map and one resource. So we created this map, and we have included the formerly used defense sites, of which there are more than 700 in Alaska, because Alaska has been such a place of great strategic importance to the US military. So we have 700 currently in formerly used defense sites, many of them contaminated, highly contaminated with chemicals such as PCBs or polychlorinated biphenyls, pesticides, heavy metals, solvents, and in some cases, massive fuel spills, as well as chemical warfare agents. Alaska was used as a testing ground for the military's chemical, biological, and nuclear warfare programs. And if you look out here along the Aleutian chain, about 3/4 of the way out, Chukotka Island was the site of 3 massive underground nuclear tests. And the third one in 1971 was the largest underground nuclear test in US history, and about 350 times the explosive power of the bomb that devastated Hiroshima. So Alaska, again, a place of great strategic importance, a lot of damage. Many of these sites are very in close proximity to Alaska Native communities and in places where people are reliant on traditional fishing and hunting. We have over now 2,000 sites in our database. Alaska is also warming at a rate about 4 times faster than the rest of the planet, and is also a hemispheric sink for chemicals and plastics that are migrating on wind and ocean currents and accumulating in the far north and in the Arctic. And we find that the problem of climate warming is exacerbating this problem because chemicals that have been sequestered in the cryosphere, that is sea ice, glaciers, and permafrost, are now being released as the climate is warming. And this is really threatening the food security and the health, especially of indigenous peoples who rely on traditional foods as the basis of their diet and culture. And we also know that indigenous peoples of the North have some of the highest exposures to many of these persistent chemicals of any population on Earth. This phenomenon is known as the grasshopper effect or global distillation. And you can see also that these chemicals do tend to, many of them, bioaccumulate in fish, wildlife, and also in the bodies of people. We conduct community-based research, as I mentioned, and these are some quotes from some of our research partners. In this case, Delbert Pungawi is a member of our Sivuqaq working group that advises our research on the island. And he is talking about the convergence among chemicals, plastics, and climate change, and the devastating effects that he is witnessing over his many years of experience on Sivuqaq. And another elder, Merle Pasangak, said, "We have always been a vigilant people. Our community-based research enables enables us to be vigilant at the molecular level. And then I think speaking to concerns about cumulative effects, one of our board members, Violet Yetten, who is from the native village of Port Graham, we don't eat just one chemical, we eat the whole fish. This is where we have conducted now many years, over 2 decades of community-based research on the island of Sivuqaq, which is the traditional name for St. Lawrence Island, located closer to the Chukotka Peninsula of Russia than to mainland North America. It's only 40 miles from the Chukotka Peninsula of Russia. So this is Sivuqaq, and it shows you the location here. And I just wanted to show some photographs of the place and the people, very traditional people. You can see a woman, that's actually Anialoa's daughter, tanning a walrus hide to create the traditional whaling vessel that you see in the middle picture here. And you see a younger woman sewing the walrus hide to the frame of the vessel. This is what the village looks like. Piped water is a relatively new thing. So sewer and water has really just come about in this and many other communities throughout Alaska very recently. And this is always important to recognize as we do our research in collaboration with these communities. These are some of the cultural values that the Yupik people of the island really hold very dear, and they ask that visitors to the island also respect these values. And this is just a representation of some of the traditional foods that are really critical to the diet and culture of the people of the island. Seals, all the different ice seal species. In the middle there, you see some invertebrates like tunicates that are really important to the diet of the people that wash up after storms, and people gather them, and they're a very treasured part of the diet. People also capture seabirds. You can see a young man here netting seabirds on the cliffs near Sivuqaq. They also gather murre eggs on the cliffs. And you can see a young man here scaling the cliffs to gather seabird eggs. And then in the center, in the middle, see one of our elders cutting what is called mungtuck, or bowhead whale skin and blubber, which is really also a very treasured and important part of the diet. And then just a representation of a plate that you might see at somebody's dinner table. The people of Sivuqaq are really world-class carvers, and so these are some representations of carvings of bowhead whale, swan, walrus, and then a hunter in a kayak, traditional kayak, carrying a seal home from his voyage. These are mostly fossil and sometimes just freshly harvested ivory from walrus tusks. This is, you see here some traditional clothing made from bird skins and seal and other parts of birds, and people do really use all parts of the animals that they harvest. They're very respectful of these animals, and they use them to make traditional clothing and carvings as well. And you can see the woman on the right here. This is a traditional tattoo, facial tattoo, that important to the women of the island. Just want to show this brief video here. This is a storm that we were in during one of our research trips recently, and were weathered in for about a week, longer than we intended, but it can be very challenging to do research out here. We've done research, as I mentioned, for over 2 decades. We run into all kinds of weather and conditions out there, so we try to be flexible. This was just a trip in the just a couple of months ago, so it can present its challenges. To go on here. Over the years, these are some of the types of samples and work that we've done with the people of Sivuqaq. We train local researchers, including one of our elders here, Harriet Panaya, who is dissecting a stickleback, which I'll talk more about later. But these are the types of samples and surveys and work that we've done, really based in the knowledge, local knowledge of elders, traditional leaders, and we've conducted hundreds of interviews, thousands and thousands of hours of interviews to really understand what people's perspectives are, to help guide our research, and to inform us about what we should be focusing on in our research. So we've collected all of these different types of samples, including bird eggs, seabird eggs, such as MERS. We've done human blood serum biomonitoring, air, groundwater, surface water, plants, all the different types of traditional foods. We've taken sediment cores. The stickleback I mentioned, and I will talk more about this little fish, is a sentinel species that really interestingly mirrors the kinds of contaminant patterns and health disparities that we're witnessing in the people. We've also done community health surveys, began a community cancer registry, and measure household dust, since that can also be a significant source of exposure of contaminants. This research is to help inform policy so that better decisions can be made that are more protective of people's health as well as the environment. So we really do start with a foundation of elder knowledge and community leadership. We've established community working groups to help design the research as well as implement it and help us with the design of community reporting and then health protective interventions. I mentioned we hire local Yupik-speaking community health researchers. The emphasis here is on community right to know, capacity building of the tribes, and then education and empowerment of community members. We believe in community right to know because for so many years, researchers have come to places like Sivuqaq and taken information, collected data, and never reported it back to the communities. So this really is a partnership, and we feel a strong responsibility to bring this information to, once we have information from the laboratories, to bring this back to the community so that they can make their own informed decisions. And we gather this information with the hope that we can work with the tribes then with this information to hold the military, which has been responsible for a lot of contamination that affects the environment and the people of the island, so that we can hold them accountable. And then we do foster collaborations with academic partners, and have had the opportunity to work with Ian, for example, when he was at Oregon State University. And now I think 7 different universities also partner with us. So we really create this co-knowledge process here, valuing traditional and academic science mutually valued and respected. We work through this process to change policy at the local to international level and develop relationships and solidarity with the tribes to hold the polluters accountable, as I mentioned. We build partnerships. We also conduct a community, college-credited community-based research institute, and that involves not only classroom experience for the students in environmental health and justice, but also going out into the field to learn techniques of sampling, from sediment and soil to biological sampling. We also provide training for healthcare providers because we find that the healthcare system is really inadequate to address some of these environmental health issues. So we have, for example, monthly webinars called the Collaborative on Health and the Environment, where we offer speakers that can present new innovative research in environmental health, as well as community experts. And we invite nurses and doctors and community health aides to join these so that they can better serve their clients and patients. These are some images of the site at Northeast Cape. It was really important, was a White Alice communication site, which was used because, again, Sivuqaq is in such close proximity to Russia. It was built during the Cold War and operated into the 1970s. It had big infrastructure of these radars and the buildings that you see in the top right, and hundreds of personnel. And they left a massive legacy of hazardous waste, including, as I mentioned, PCBs, pesticides. We found elevated levels of pesticides, mercury, lead, asbestos, solvents, and huge fuel spills, which were released from some of these large tanks from the main complex into the Sivuqaq River. When the military came to Sivuqaq at Northeast Cape, they displaced a community that was there. There was a tribal council. There were about 130 people who lived there, and this is just the remnants of a graveyard. And this was a place of great value to the people of Sivuqaq, and one of the most productive areas for fishing, hunting, and gathering. There were year-round residents that were then displaced to Sivuqaq, and now there are just a few remaining fishing and hunting cabins that exist out there. And the hope with this project is that we can work to reestablish, to make it a healthy place for the community to reestablish at Northeast Cape. And that's really the vision of the people of Sivuqaq. When the military came to Sivuqaq in the early 1950s, they really welcomed the military there. They felt proud and patriotic to serve as the eyes and ears of the North. The men from the island were very much a part of the Alaska Territorial Guard, and then that became the National Guard. They were called Eskimo Scouts, and they traversed the Bering Sea and around the island to keep an eye out for Russian spies, and really to serve as the eyes and ears of the North. The military and the tribe at the time entered into an agreement in 1951 where the tribal council granted the military access to the island with really clear conditions that the military would clean up its waste when their mission was accomplished there. But that agreement, of course, has been violated, and now we're working very hard to try to hold the military accountable to clean up this environment that was so incredibly violated and damaged. The person you see on the right here is the father of my colleague Vaiwahi, and he was a first sergeant in the Territorial Guard. So the people, I would say, now feel that their trust was betrayed. So it's really important that we do this community-based research and the policy work to hold the military accountable. These are some of the health disparities that we've witnessed and heard the perspective of elders speak about. Some of these diseases were not known before the military began their occupation at Northeast Cape. So people on the island describe what they see now as a cancer crisis. We see endocrine disorders such as thyroid disease, diabetes, cardiovascular diseases, and certainly reproductive health problems and as I mentioned earlier, low birth weight babies, birth defects, and premature births, and developmental and learning disabilities, which is why we began this project called Protecting Future Generations, because people, especially elders at the time we began this project, were concerned that the young people were not able to hold their attention, that they had learning and cognitive problems that they attributed to exposures to toxic chemicals. This was one of the first studies that we did at the request of the tribes to measure levels of PCBs in the people of the island. And we had 3 groups, and we measured blood serum levels of PCBs and also pesticides, and found that all of the people of the island have elevated levels of PCBs when you compare the levels that you would find in an average person in the lower 48. But the highest levels were found in the people whose families have traditional ties to Northeast Cape. We've done a wide range of traditional food sampling. You see Morgan Apatiki here preparing some samples, and we've measured contaminants in everything from plants, berries, greens, medicinal plants, to fish and wildlife, as well as people. But we work with traditional hunters to harvest animals to do contaminants analysis. These are some of the results that are summarized from a paper that we published in 2011, and this concerns PCB levels and relatively low levels in, as you would expect, in plants and berries that are important to people's diets, and then really extraordinarily high levels in animals such as the bowhead whale and the polar bear and bearded seal. And these are at levels that would exceed the EPA's guidance for consumption, for fish consumption, for excess cancer risk, many times higher. Whoops, sorry. Okay, here we go. More recently, and this paper was published in 2022, and I have a list of all the papers that we've published at the end. We did sampling for the PFAS chemicals, per and polyfluoroalkyl substances, which, as you probably know, are a class of very complex class of many thousands of chemicals, about 12,000 or more in this chemical class. And we measured levels of PFAS in seal, reindeer, bowhead whale, among other species, but this is just a summary of some of our results. What we found was really interesting. We found congener patterns that were different in the seal species here in this region of the Arctic than in other Arctic studies. And one of the PFAS congeners, PFPEA, was the most frequently detected and in the highest concentrations in the seal tissues, then followed by PFHXA. So as far as we know, no other study has shown this type of congener pattern in the Arctic. And we think that this is a result of biotransformation of precursors. We find different patterns in human sampling that we've done. In fact, the humans tended to accumulate the longer chain PFAS. This shows the relative concentrations of certain PFAS in dust and serum. And again, this paper was published in 2017. So you can see the higher levels of the longer chain PFAS substances, such as PFOA, PFOS, and then PFNA. So not only are traditional foods an important exposure route for persistent pollutants such as PFAS, PCBs, and others, but we're also finding levels of concern in household dust. This is a study that we published in 2022, and one of the reasons that we undertook this study was that the Corps of Engineers, which is the agency responsible for the cleanup at Northeast Cape, was really moving toward closing out their remediation activities at Northeast Cape. And we were very concerned that the job was not complete, that there were still major sources of contamination affecting this watershed, which is the Sivuqaq River flowing through Northeast Cape. And in fact, we did find elevated levels of both mercury and PCBs in the Dolly Varden, which is important to the traditional diet of the people of Sivuqaq. And the levels were elevated downstream from the main complex at Northeast Cape. So this really, we hope, will now inform a new health assessment that we are trying to get the Agency for Toxic Substances and Disease Registry to conduct. And we've been in dialogue with them recently. I mentioned the stickleback as a sentinel species, and you can see a picture of this little fish. It's only just maybe 3 inches long, but it really is a sentinel fish because it seems to reflect the patterns of contaminant levels as well as disease patterns that we're seeing in people as well. Same is true of the blackfish. So we've done quite a lot of collection of stickleback, both here at Northeast Cape, and then in the middle center, you see Troutman Lake, where Ian has spent some time collecting samples as well. And then these stickleback are then analyzed for a range of contaminants, and we look at how these contaminants might affect their endocrine system, especially their thyroid and reproductive systems. So we found that PCB concentrations are disrupting the endocrine function of fish, including both thyroid and reproductive systems, and decreasing expression of genes that are important in repairing gene mutations, which we think is indicative that these chemicals are linked with diseases such as cancer. The PCBs are also feminizing the fish. So we're finding vitellogenin, which is a protein that's usually found in female fish, egg-bearing fish, females. And again, this indicates exposure to estrogenic contaminants. Certain PCB congeners are estrogenic. And this also shows that after fairly extensive site remediation, and the Corps of Engineers has spent about $125 million on site remediation, but it's been very superficial. They've taken a lot of the debris, the barrels, and infrastructure from the surface of the island at Northeast Cape, but there is still a lot of contamination in the subsurface, in the ground, from unlined, uncontrolled landfills that have leached these chemicals into the subsurface groundwater. And we found also, interestingly, in the fish, especially very high levels of the flame retardants known as PBDEs, or polybrominated diphenyl ethers, and especially these particular congeners, as well as PFAS. And our hypothesis is that these are from local sources such as the landfills that have been uncontrolled there for the most part. These were some of the key findings so far, and we're still in the process. We were just out there 2 months ago collecting additional samples at the request of the tribes, but we found extensive exposure to the polybrominated diphenyl ether flame retardants, and these are chemicals that are used in many different products that we use in our homes. These are largely phased out now, so they're legacy contaminants, but still present in the polyurethane foam, carpet padding, and other products that we use in our home. They tend to leach out in the dust, and people are exposed through household dust, especially toddlers and young children. So we found in particular 6 of these PBDEs in 100% of the serum samples, and another 10 in 95% of the serum samples. We're finding levels in serum that are higher than those of the Canadian Inuit just around the circumpolar Arctic And again, with regard to the PFAS, we found especially high detections of PFOS and PFNA and PFOA as well. So while these levels of serum PFAS are comparable to the US general population, we're finding a couple of the congeners that are elevated compared with people in the lower 48. And these exposures were linked with or correlated with both PBDE exposures to certain congeners as well as PFAS. These are some photos of our community-based research institute that we've held in Nome, as well as Gamble and at the University of Alaska. And this is where we train local people from the communities of Sivuqaq, as well as throughout Northwest Alaska. And we spend quite a lot of time in the field, as well as set up a laboratory situation and classroom instruction in environmental health. See people are collecting biological samples, stickleback, dissecting some of the macroinvertebrates that we found in local streams under the microscope. And the young man in the lower right is collecting a sample to test for PFAS. And yeah, different types of environmental sampling for macroinvertebrates, fish, sediments and soil, air sampling. We also do a lot of training as well as organizing with young people in human rights, in addition to the environmental health and justice field experience. We work at the United Nations level, and this is a group of women meeting with the United Nations Rapporteur on the Rights of Indigenous Peoples. And we do training, especially for women and girls, concerning how they can get involved in changing policy, how to testify with their legislators and elected officials, and also work to reform not only chemicals policy, but the healthcare system. I'm going to talk just a little bit about our international work. We work at the international level because these chemicals don't respect political boundaries, and the Arctic is a hemispheric sink for chemicals that affect people's health and well-being. We worked from the very beginning of the negotiation of the Stockholm Convention, which is the only global legally binding treaty that is designed to eliminate the world's most dangerous chemicals. At the time that the nations of the world came together to negotiate this treaty, scientists in Canada were finding elevated levels of chemicals like PCBs in the breast milk of women living in the very far north, Inuit women living in the very far north. And this was alarming. This was really something I think that woke the world up to the problem of the implications, the global and international implications of the continuing production and release of chemicals that can harm people at distant locations where they're not manufactured and used for the most part. So this is a human rights issue, obviously. It's an issue because people are exposed to chemicals without their consent. And this treaty acknowledges both the importance of human health and human rights, and acknowledges the particular vulnerability of Arctic ecosystems and indigenous communities. The statue in the lower right of the slide is a soapstone statue that was presented by an Inuit leader named Sivuqaq Cloutier to the negotiators of the convention. And now every time that the Conference of the Parties, the 182 nations that are now party to this convention, come together, this statue sits at the front of the room of hundreds of people that are working together to address this global issue. And in the center there, you see a representation of Arctic Indigenous women who travel to the Stockholm Convention, which is usually held in Geneva. Switzerland to make sure that this is not seen as an abstract issue. This is an issue that affects the health and lives and future generations of people living in the Arctic. This is Sivuqaq testifying before thousands of delegates at the Stockholm Convention. The chemicals present in our bodies are passed on to our indigenous children and harm their ability to learn our languages, songs, stories, and knowledge. And recognizing that this is an intergenerational problem and that we have to work together to protect the health of future generations. Say a little bit about our research on PFAS. This is in a Southeast community. In this paper is published, and I have all the citations at the end of the presentation. This community is a relatively small community of about 400 people at the gates of Glacier Bay National Park. And most of the residents in this community are on private wells, and their wells were contaminated with PFAS from the airport because the airport used a product known as AFFF, or aqueous film forming foam, which is a firefighting foam used mostly on military bases and airports to control fuel and chemical related fires. It migrates very quickly in water, and most all of the wells in this community were contaminated. We found 14 different PFAS in water samples, and then an additional 17 different PFAS in blood serum of people, and the blood serum levels were highly correlated with levels in the drinking water. So now this place is undergoing remediation, but it's very difficult to clean these substances up, PFAS substances, once they're released into the environment. These are a couple of investigative reports showing the nature and extent of PFAS contamination throughout Alaska. And we now know that there are approximately 469 sites around Alaska that are contaminated with PFAS. And in this project from 2023, we found concerning levels of PFAS in every water body that we collected samples from in the greater Fairbanks area, as well as Anchorage, the municipality of Anchorage. So here's a map of just really some of the PFAS contaminated sites around Alaska. And there are many communities that now have unsafe levels of PFAS in drinking water. And certainly this is not a problem unique to Alaska. And I'll just say that because of the military, the huge military presence and the high reliance that we have on air travel in Alaska, it seems that we do have a preponderance of sites affected by AFFF, or the aqueous film forming foams that are PFAS based. And now many lakes that are closed to fishing because of PFAS contamination. This is another concern to us now in Alaska, because not only are chemicals globally transported and concentrating in the Alaskan Arctic and the circumpolar Arctic, but microplastics are also now found extensively throughout the Arctic in surface waters, as well as sediments and beach samples. And this is just one voyage that collected microplastics throughout the Arctic. It's now thought that Arctic Ocean surface waters hold the most plastics of any ocean basin on Earth because of the prevailing currents. There is hope on the horizon. The nations of the world, as they did with the Stockholm Convention, have come together to negotiate the first global legally binding convention on plastics. And there's a negotiating session coming up very soon here in April that will be held in Ottawa. And I think now over 180 nations are a part of this negotiation, which is hopefully going to result in a strong protective treaty by the end of 2024. And this is really the purpose of all our work, to inform remediation decisions. We're working with ATSDR, the Agency for Toxic Substances and Disease Registry, to conduct a new public health assessment for Sivuqaq. We conduct many community health meetings and summits to inform decisions, but also, excuse me, involve people in ways to restore the lands and waters. One moment. And here you see in the community meeting, Dr. Linda Birnbaum, who is now the former director of the National Institute of Environmental Health Sciences. And this is a delegation of leaders from the island who traveled to Washington, D.C., which we hope to do also again in May, to inform policymakers. These are some of the recommendations that we have for policy changes. We need comprehensive chemicals policy reform so that it can be protective of people's health as well as the environment and to prevent harm. We want to shift the burden of proof, and that means adopting a polluter pays principle to hold both military extractive industries accountable for not only responsible cleanup, but for prevention. We work on making sure that policies adopt a precautionary approach, which means to prevent harm before it occurs, better safe than sorry. We train scientists. I mentioned public health officials, the work that we're doing to educate healthcare providers so that we can also transform the healthcare system to be more responsive, to not only diagnose and treat, but work toward prevention of harm. We observed that IMA's principles of environmental justice and also the Louisville Charter were part of a national network called Coming Clean that worked together to protect the health of fence line communities and the ultimate fence line, which is the Arctic. And this is really why we do this work, to protect children's health and the health of future generations. Again, recognizing our elder and teacher, Annie Aloha. And I'll just flip through these and make my presentation available for those who want to look at the papers that we've published. And this is a quote from the author Marla Cohn from Silent Snow. How could the Arctic, seemingly untouched by contemporary ills, be home to the most contaminated people on the planet? I had stumbled on what is perhaps the greatest environmental injustice on Earth. So if you haven't read this book, I highly recommend it, Silent Snow. This shows some more recent gatherings that we held last summer in Fairbanks. We brought together Indigenous leaders from throughout Alaska, as well as agency leaders from different agencies such as the Department of Energy, Department of the Bureau of Indian Affairs, EPA and others, to figure out ways that we could work together and ways that we can change things to better the health of people throughout Alaska. We had a meeting with Admiral Levine, Assistant Secretary for Health, and we were able to travel with her out to the island to talk about the problems that people are facing with regard to their health. These are some of the research partners that we're working with through support from the National Institute of Environmental Health Sciences, so several different universities there. And I thank you.
Well, fantastic. Thank you so much for that presentation, Pam. I'm always so impressed by the diversity of work that you're doing. Everything from really grassroots, community embedded work to kind of build that environmental health literacy, all the way up to getting these community members' voices heard at a really large scale international level. So I'm always really excited to hear about the great work that you're doing. A couple interesting themes came up in your talk that I'd love to discuss more. One that came up in the project that you and I were collaborators on was this idea of growing concerns in Arctic communities related to physical and chemical hazards related to climate change and the intersection between climate change and contaminant threats. And so I was wondering if you could kind of speak to some of the concerns that folks that you're interacting with have around those issues and what you've been able to find out about them.
Yes, at the cryosphere is really vulnerable in the Arctic right now, and sea ice is melting rapidly, and so sequestered chemicals, legacy, and also more currently used chemicals that have been sequestered in sea ice are now being released as the sea ice melts into the most important areas for traditional fishing and hunting, where people are gathering the foods that sustain them. So it is a real food security issue. This is also now true of microplastics, and microplastics are also conveyors of chemical contaminants. We know that plastics contain over 16,000 different types of chemicals. And as these microplastics move northward, the chemicals that were used to make them, as well as chemicals that they absorb in their travels, so to speak, are also now being conveyed into the food web through the uptake by especially animals that rely on plankton, like fish, as well as many of the planktivorous seabirds, and chemicals such as relatively new one, but a very high production volume chemical called UV328, which is a UV stabilizer used in plastics, has been now found in many seabird species in the Arctic, but also remote islands throughout the world. And this chemical has many adverse health impacts associated with it, both for wildlife and people. So it's really, I see a convergence with climate change now exacerbating this problem of mobilization and transport of chemicals, both within the Arctic and into the Arctic. And once these chemicals and microplastics arrive into the Arctic, they really have no place to go from there. They're bioaccumulative and they remain there and can cause harm for many decades to come.
Yeah, thank you for that. I think that's a really interesting topic, thinking about the remobilization of these chemistries that, we got done with these organochlorine pesticides decades ago, and even though they can be in trivially small concentrations in the ice, just given the scale of material that's melting, we're talking about release of tons of organochlorine pesticides from the Arctic and Antarctic. So I think these are really important and pressing issues that are relevant to our field. Another topic that came up that I think is really important to think about, and I know you're really involved with, is sort of balancing the hazards that are inherent to contaminated traditional foods with the cultural and health benefits that co-occur with those hazards. And so I'm curious if you have some examples of hazard or risk communication strategies that acknowledge the benefits of traditional foods as well as recognizing the potential harms.
Yeah, it's a very complex problem that the people of the North are facing. And in our own work, we make sure that we see this as a community right to know issue. So we present our findings and present what we think are the significance or meaning of the findings in terms of health risks, as well as the well-known benefits of traditional foods from a cultural, dietary, every perspective. These traditional foods have sustained the people of the Arctic for generations. So it's very important to acknowledge. And then we present this information and have detailed discussions about it. And then our view is really people, of course, have the right to make their own informed decisions. And for the most part, people have decided that it's important to continue their reliance on these traditional foods, recognizing the hazards, but also it has inspired a lot of action and willingness of people to work for change, knowing that it might not benefit their own generation, but they are truly working for future generations so that these foods can once again be safe and sustaining and healthful for people.
Mhm. Yeah, that's really inspiring and a great positive note. I think it's reassuring to see the kind of societal perspective shifting towards a view that places greater emphasis on right to know and autonomy of folks that are involved in research work, as opposed to some historic examples we can think of when these communities were denied access to that information for fear that um, essentially the public health folks might be able to make better decisions for the community members than they could make for themselves. Yeah, those are all really interesting aspects. One other question I had was related to solid waste in the Arctic. I know that uh, I guess I've seen change in Sivuqaq in the community of Gamble as far as their ability to deal with solid waste. And I've seen growing concern in a lot of native communities around the lower 48 about unpermitted disposal of solid waste and the impacts that has on community members, as well as some fires that happen in some other Arctic communities that expose children to flame retardants. And so I'm curious if you can discuss concerns around solid waste management and opportunities for improvement there.
Sure. I want to go back to your previous question just for a moment. I wanted to say that we've had pushback from public health agencies on these issues because, of course, they want people to recognize the value and the health benefits of traditional foods and are concerned that research like this will frighten people away from continued reliance on traditional foods. So we've had to also, I think, address that issue because I think in some instances, agencies have not wanted us to present these results back to communities, and we don't think that that's right. And we have many examples of researchers not doing that and allowing that autonomy and that right to know value of having people make their own informed decisions. So it's been a very difficult issue to reckon with, and to have agencies really understand the value in presenting these results back as well. So,
Mhm. Yeah,
so on to your question.
fantastic. No, I'm sorry. I think we need to finish. That was great. I'm really glad you had a chance to elaborate on the these tensions with regulatory agencies. Thank you so much for your presentation today. We really appreciate you taking the time to share this great work with our community in the speaker series. So thank you again for your presentation.
Thank you. Sorry we didn't get to your last question.
No problem at all. Thank you so much.
Okay. Thank you again for the invitation. Good to talk.
Absolutely. Fantastic. All right. Bye-bye.